Hello, this is Dr. Park. In this video, I'm going to talk about space maintainers. These are space maintainers, different kinds that we use on our patients. Now, there's two kinds of general categories of spacers. The ones you see on this model are what we call unilateral. Basically, it covers one side of the mouth. And you can get a side view of those on these models. Now, what you can see from here, that is the baby tooth that spacer is anchored onto. That's the permanent tooth that we're saving the space for. And that's the other permanent tooth that has not come in yet, that we're also using as a partial anchorage to make sure that space is preserved. This is what I call a bilateral space maintainer. In this particular example, this is called a lower lingual holding arch. So that's used when we have any child that has lost 2 teeth or more within the lower arch. This is her patient's bottom teeth. Or have lost certain teeth and have a combination of teeth that require a spacer that covers both sides of the mouth. Now, spacers are meant to be there until the permanent tooth that it's holding the space for starts to show up. One analogy I use for parents and sometimes kids is that it's almost like saving a parking spot. Let's say you have a car that needs to park in the space. Now, imagine that parking spot's taken up and there's no room for that tooth to come in. Then you might park the car a little bit funny off to the side. Maybe the car cannot be parked, so the whole plan is ruined. So it's the same idea. Sometimes, for various reasons, and usually it's food related, the spacer gets loosened up. What happens is then spacer pops up and you end up chewing and warping the spacer, or sometimes even more uncomfortably, the spacer gets loosened up and it starts digging into your gums. And I've seen in the worst case, you sometimes get a little gum abscess that we have to make sure we remove the spacer for. So rule number 1, you want to avoid any hard and sticky foods as best as you can on the side where the spacer is put in. So right here, you want to make sure you're avoiding things like, for example, Laffy Taffies, Skittles, Gummy Bears, Starburst, Jolly Ranchers, Swedish Fish. I mean, you name it, everything you get in your bag during Halloween, yeah, you probably don't want to be chewing on those while you have the spacer on. And if it happens to get loosened up, a couple things you can do. If you're able to safely retrieve it and set it aside, and then bring it with you to the office as soon as you can, that's probably the best thing to do so we can firmly re-cement it for you. If not, just give us a call as soon as you can so we can walk you through what you can do. Ultimately, the main goal will be to make sure that it's replaced and secured so that the purpose of it to save that spot for the permanent tooth does not get compromised.